Hello, Thunder Bay. Over the course of the last several weeks, I've had the opportunity to reinforce the importance of physical distancing as the best way we can all contain community spread of COVID-19. We don't have a vaccine, and the best tool we have to minimize the number of people that get sick and potentially die is by assuming our individual responsibility. We must respect the seriousness of this issue and respect those people most at risk, our seniors and those with underlying health conditions. Our decisions on service reduction have always been underpinned by the advice of medical professionals and with the safety and security of the public and our employees in mind. As well, a number of our services have been suspended as a result of emergency orders given by the province of Ontario after their declaration of a provincial emergency on March 17th. Informing my input on our decisions has been a concern for the capacity of our hospital and health facilities, including long-term care homes, to manage a significant increase in numbers of people with this illness. Most North American hospitals, including ours, do not have the capacity to manage a surge in numbers. While our geographic isolation has allowed us time to prepare as best we are able, we could quickly be overwhelmed in numbers if we don't continue to contain community spread. It is for that reason that some time ago, I reached out to many Northwestern Ontario mayors, asking them to do whatever they can to strengthen the capacity of their local hospitals. I have reached out to the Office of Provincial Minister of Health, Christine Elliott, asking her office to please do what they can to work with district hospitals and healthcare facilities to provide a greater ability to service the need of their individual communities. If they are unable, this will create a greater challenge for Thunder Bay Regional. We are all working together, and while our hospital has a regional role to play, we also know that people prefer to be accommodated in their home communities wherever possible. Finally, last week, our Municipal Emergency Control Group made the decision to communicate to the Provincial Emergency Operations Centre that we cannot at this time support any evacuees with our first responders. The City of Kapuskasing has recently made a similar decision to not accept evacuees at this time. While this decision was made in part because of COVID-19, it is a decision that has been contemplated for some time. Weeks ago, I sent a letter to PEOC and to provincial and federal cabinet ministers advising them of my concern regarding the ability of Thunder Bay to support an evacuation. As our community is well aware, our first responders, our paramedics, our police, and our firefighters have been stressed and stretched beyond our limits for some time. When I met with the provincial minister responsible for the file in January at the Rural Ontario Municipal Association conference, I advised her that a letter would be coming and that it was my hope that the province and the federal government would more proactively plan for the inevitable evacuations that occur every year and to work to identify more willing host communities. Last year, some Ontario evacuees had to be sent to Saskatchewan. This is an unacceptable situation. As we head into the Easter long weekend, I want to thank you for your patience and understanding regarding the decisions and choices we are making as a corporation. We know they are impactful, and this situation continues to evolve. There will likely be more difficult decisions yet to be made. Please understand these actions are rooted in the health and safety of our community and guided by healthcare professional information and provincial orders from the province of Ontario. Stay well, Thunder Bay, and thanks for watching.